dissociate. Dissociation is when your mind is not in your body, and it's a useful way to survive overwhelming circumstances, but it causes problems when it continues to happen in normal situations. So the mildest form is daydreaming, which everyone does. And the most extreme form is split personalities, which happen to people who are subject to severe prolonged childhood abuse and torture and have no other method of escape. So somewhere in between the two is an eating disorder. And ignoring the body's signals, such as hunger, is a form of not being in the body, and obsessing constantly about what you ate or didn't eat or want to eat is another. Purging sometimes can happen in a dissociated state, which makes choosing not to do it a complicated matter, because the person's not in full control. And the other functions I listed under avoiding emotional and psychological issues, which is really just a broader umbrella that trauma falls under. So, like sex drive, not meeting the food need precludes any emotional needs. So that's a way to avoid scary emotions. Obsessing about food also prevents any emotions from getting through. Sometimes people have experienced a loss of something or someone they depended on, and that's traumatic. So they respond by trying not to depend on anything at all. So if I don't have to eat, that shows that I'm very strong. I don't need anyone, I don't even need food. And of course, I'm in control, which is nice when really difficult things happen that are out of someone's control. So people can also use starving, purging, and binging as a way to punish themselves. And this is a trauma thing too, because punishing oneself can be a compulsion to be re-victimized or a way to take control of past victimization. So if you can blame yourself for whatever happened, and people do this in a number of ways. I've heard people say, I got raped because I was attractive, and others say, I got raped because I was unattractive. So they punish themselves for that offense by starving to be attractive or unattractive, or binging to become unattractive or to remain unattractive, because that reinforces the belief that it was your fault, and therefore it can be avoided in the future. If you punish yourself by saying, I'm going to not eat, or I'm going to eat to the point of harming myself, that's punishment. And so it's a devastating way to look at trauma, but it also can be less scary than admitting we're totally powerless to stop it. All right, so moving on to some of the issues that we have in the eating disorder community right now. This is another quote from someone about their doctor. I'll read it. I told my doctor that I thought I had an eating disorder and needed treatment. He then went out and asked my mom about my eating habits. She told him I ate nothing but a candy bar or two every day. His response? Well, someone who was really anorexic would never eat a candy bar. She must be just trying to get attention by faking an eating disorder. So this was really problematic because 2 candy bars is nowhere near enough calories for a whole day. And denying that there's a problem is, like I said, a really good way to shame someone with an eating disorder and to help them to continue it. Right. One of the battles eating disorder patients have to face, in addition to the battle with the eating disorder itself, is getting a diagnosis. So one of the biggest problems right now is that there's a weight requirement for anorexia, which I sort of mentioned in my own story a little bit. Right now you have to get down to a BMI, that's body mass index, which is a ratio between your height and your weight. You have to get down to a BMI of 17.5 to qualify as anorexic. And 20 is considered kind of a minimum acceptable BMI for being not too thin. So 17.5 is well below that. And I didn't get there because of my muscle mass. But the BMI scale is notorious for inaccurately representing body fat percentage in athletes like me, but it's also inaccurate across race, and it doesn't actually predict health in any significant way. It also forces people who started a higher weight to wait much longer to get the diagnosis. And Meanwhile, these people are usually being congratulated for their weight loss, when really they have all the same physical problems as those who get underweight. And also, the longer you wait to get to treatment, the harder it is to recover. That's been shown in studies. So having a criterion that doesn't recognize severity for a long time really constitutes doing harm to the patient. And another way it harms is by encouraging treatment modalities that focus on physical aspects like weight.